So I do neurology, and specifically within neurology, I focus on multiple sclerosis and other autoimmune disorders that affect the brain and spinal cord. So things like neuromyelitis optica, MOG antibody disease, sarcoidosis, or autoimmune encephalitis for the most part. Every time I would meet a patient who had MS and kind of hear their story, there was always that time when they were so afraid because their body and their mind weren't working the way that they expected them to, and this person was typically in the prime of their life. It usually hits you in your 20s or 30s. It's not your grandmother's MS anymore. It's a really different world. It's one of the areas of neurology that we've been incredibly successful at developing treatments and drugs to prevent damage from disease building up over time. When you first come in, you'll actually meet one of our medical assistants in the intake room, and beyond just getting your blood pressure taken and your pulse, we have people do some specific what we call neuroperformance testing. We check your manual dexterity, your vision, and do some surveys about fatigue, depression, other things that can impact neurological diseases. What I like to get out of people is their goal for the visit. What made them come in to see me in this office today, and how can I meet them where they're at to make sure that both of our agendas get taken care of. I like to get to know my patients a little bit on a personal level. They're typically people that I'm going to work with for some time going forward, and knowing what's important to them in their life and their hobbies and their goals and the things that they like to do are actually things that help me determine their treatment plan and their treatment course with them. I did my training here, but more than that, I grew up here in the community. So I've known the institution for a long time, and it's sort of helped shape the doctor that I am. But what I always wanted to do, and why I stayed with the Cleveland Clinic, was to be able to bring this level of expertise, innovations from research, and the compassion that I meet from the people I work with, trainees, to our Cleveland community.